So I told Carl to do something a little bit more like slow jazz, and we're going to try something else tomorrow, maybe some piano jazz. Today we're going to be talking about the blood clotting condition and complication. You know, again, as I mentioned yesterday, you often hear some of the most interesting things from viewers and patients and folks that are not in the medical area, but just read a lot, or they happen to run into a problem because of what's going on with them. Someone asked me a couple of days ago about all this clotting, and I thought they were talking about DIC, disseminated intravascular clotting. It's part of what happens with a lot of people in intensive care. Although I had heard about the young actor, the young Broadway actor that lost his leg due to some clotting. We're going to talk about that clotting. It's not crystal clear yet that this is something different, but I think it is. So we're going to talk about that today. Upcoming topics: is it safe to eat takeout? I hope so. We tried it last week for Janice's birthday. Coronavirus attacks the immune system like HIV, and which states are doing enough COVID-19 tests? Carl, if you could let Chris know, I think we've got some updates on some of the topics that he's got set up for us in the coming weeks. I don't think it's entirely that it correlates entirely correctly. Previous topics: pulse oximetry and the silent infection that's killing us. Wanting to keep an eye on, if you do get infected, what's the most reliable indicator of going south or going bad? And it may be our blood oxygen level. Joe Riley suggested that. There are folks that would say, no, you don't need to look at that. I think they may not be thinking through the whole process very well, like specialists often do. Finding effective treatments for COVID-19, a perennial interest area. Pregnant women and coronavirus. I just saw an article this morning about kids. There is some inflammatory process, serious inflammatory process being reported out of the UK for kids. Up until now, we weren't seeing that much. We plan to talk about that a little bit more. And my favorite topic recently is the conditions for ending lockdown. So there is a huge amount of debate growing in that area. And a lot of folks are saying that we're overreacting. We need to just go ahead and let nature take its course. Just so you know, I got ridiculed back at Johns Hopkins 30 years ago at the School of Public Health for being the guy that was most focused on the economy. My perspective was this thing that a rising tide raises all boats was very, very true. What that means in public health vernacular is it's the economy. If you have a poor economy, you're going to have poor public health. If you have improving economy, that will improve the public's health. So I've been majorly focused on the economy, much more so than any of my peers. In fact, I've worked in the workplace area, Toyota for a decade, Kroger for helping set up access to care. Places where docs don't usually work, because I believe that business drives health. Am I saying that we should all leave our houses? Not quite yet. And I know, again, that's a very emotional topic. A couple of quick items before we get started on the clotting discussion. We've got a webinar. If you're one of those, let me see. Well, there are 300 million people in the U.S. I don't remember how many of those are, maybe that's adults. The CDC used to think there were 80 million people with prediabetes. 72 million don't know about it. Actually, the data would indicate there's a lot more than that. Now, also the facts, the science would be very, very clear that these people are seeing doctors, very well qualified docs. It's just that the docs are missing it. If you'd like to find out a little bit more about whether you're one of those folks, the majority, then give us a call. Take a look. We're setting this up where you don't have to break your relationship with your doctor. Please keep that. But you can find out and confirm whether or not you have insulin resistance or prediabetes. And of course, we're available. We still have slots available for care. I'm getting for care while you're locked up with COVID or locked up because of the COVID pandemic. I am getting much busier in terms of helping, again, large employers get folks back to work. But we still do have slots if you're in need. And speaking of webinars, again, the webinars have been very popular. It's a great way to get access to some types of medicine, some things that I know and specialize in that your doc just does not know that much about. For example, CIMT, plaque, evaluation of plaque. Again, most docs tend to think, well, the way to find out if somebody has plaque is to do a stress test. A stress test is only going to tell you if you've got 50% occlusion or more. 2/3 of heart attacks occur with people less than 50% occlusion. So again, this is a great way to start finding out, do I have plaque? And maybe my doctor doesn't know it. Just like the other one, do I have prediabetes? And maybe my doctor doesn't know it. So quick update on the book. Again, it'll be called What a Stress Test Can't Tell You. It's between 5 and 8 million stress tests are done each year in the US. I think that the rate of those things has plummeted. And personally, I could not think of a better thing to happen for the health of the Americans, the health of America, you know what I'm trying to say. What I'm trying to say, we need to be doing less stress tests. They provide a false sense of security at best. We need to be looking at other ways of finding out whether we've got plaque. And guess what? Ask your doctor this, or Google this. False positive, false negative rates of stress tests in the US. The snippet will come up and tell you, of the 8 million stress tests being done, we know that 1.5 million are false results. Are you feeling lucky? Okay, so we're going to start with the blood clotting discussion right after the water ball. Carl? So as I said, a viewer asked me about these clots that were going on. Again, I was thinking of the ICU clots because with COVID-19, a lot of folks are ending up in ICU. But one of the things they're finding, and it's mysterious, is that blood clots are appearing in younger people. In fact, significant blood clots, even strokes. So here, let's go over a couple of points about it. 38% of 184 COVID-19 patients in the ICU have abnormal clots, according to a Dutch study in thrombosis on April 10th. In China, more than 70% of the 183 patients who died of COVID-19 had small clots just riddled throughout their body. The problem we're having is that we understand there's a clot, yet we don't understand why. That's a quote from Lewis Kaplan, a University of Pennsylvania physician and head of the Society of Critical Care Medicine. In autopsies, instead of pneumonia and damage to the air sacs, there are just, again, these multiple tiny clots permeating the tissue. No one knows if it's a direct assault on blood vessels or hyperactive inflammatory response. Again, I think that's one of the key questions at this point. Blood clots in COVID-19 are different from those with Ebola, dengue, Lassa, and other hemorrhagic fevers. Again, these, no, I'll just go on to the next point. Some people's lungs fill with hundreds of microclots. They break off and travel to the heart or brain and cause a stroke or heart attack. I mean, that's the definition of a stroke or heart attack, a clot going to the brain or to the heart. This raised the use of blood thinners for everyone with COVID-19, even those at home, to prevent clots. Now, even those at home, I'm going to clarify. Again, these are just discussions that are going on. With anytime you start having clotting problems, there are medicines for that. Warfarin, aspirin. Baby aspirin is an antiplatelet, not exactly the same thing as an anti-clotting mechanism, but accomplishes a lot of the same types of things. And for those of us who know we have significant atrial fib, like myself, many of us are already on clotting mechanisms, clotting drugs, NOACs, novel oral anticoagulants, rivaroxaban, Xarelto, Eliquis. One of the viewers, commenters, brought up that the NOACs are very expensive drugs. There's no question about them. I think when they came out, they were like $2,000 a year. For those of us who need to be on them, or between insurance companies, for example, at one time when I had been insured with an employer, had retired, I went on with a program that the NOAC company, the Eliquis maker, was making available for folks to make it less expensive. But that's purchasing those drugs. Let's go back to the actual information about this clotting, because it's not that well understood yet. Again, happening a lot with very young people. Thomas Jefferson University hospitals found 12 patients treated for large blood blockages in their brain. In other words, large strokes. 40% were under 50 years old and had few or no risk factors. Again, we keep saying this is a disease that's killing baby boomer men. It's maybe what, 2/3 men? So there's a lot of women involved. And guess what? Some of these people are young. Have you seen the pictures of the actor, the Broadway actor that lost his leg? Very young, looked like he was in his 30s, and otherwise healthy young man. That's what you're seeing here. 40% of these people are under 50 and few to no risk factors. So a stroke, for those of you who are not that familiar with this channel or the issues, what is a stroke? It's a interruption of the blood supply to the brain. There are a lot of things that can cause it. Usually when it happens, it's due to what we call prediabetes, insulin resistance, a clot going into the brain from inflammation of the cardiovascular system, the arteries that supply the brain. So heart problems can cause that as well. That's the reason that folks on atrial fibrillation take the novel oral anticoagulants. Many strokes often don't cause permanent damage, but they demonstrate that you've got that process going on and that you've got significant risk. A mini stroke should not be ignored. And obviously bigger ones can be catastrophic. They knock out huge portions of your brain. COVID-19 patients mostly experience the deadliest type of stroke. Large vessel occlusions, large clots that knock out major chunks of the brain. Recent stroke patients with COVID-19 are in their 30s and 40s. Now, the median age for severe stroke outside of COVID-19 is 74. It's in the 70s. This may be a direct consequence of blood problems that produces these mysterious clots all over the body. The clots usually appear in arteries, but in COVID-19, they're seen also in veins, which again, significant difference from your typical cardiovascular inflammation, pre-diabetic type of stroke. And it makes it trickier to treat because, again, we don't understand those as well at this point. Some patients are even developing more than one large clot. So, Carl, you want to show the video?
We learn more each day about the coronavirus. The symptoms are similar to pneumonia, but we now know patients can lose their sense of taste or smell, and there are reports of patients with lesions on their feet or swollen toes. Here's our chief medical correspondent, Dr. John LaPook, on another dangerous symptom, blood clots.
So far, the one predictable thing about the new coronavirus is that it's unpredictable. It first got our attention by damaging the lungs. But now doctors are finding it can wreak havoc throughout the body. One way is by causing blood clots, for example, in the legs. And that adds insult to the injury already caused by the virus, says cardiologist Dr. Samin Sharma of New York's Mount Sinai Hospital. The abnormal clotting can be widespread. Those clots can damage the kidneys, leading to dialysis, the brain, causing confusion, seizures, or strokes, and the heart, causing an irregular rhythm or a heart attack.
And that's presenting doctors with a tough challenge, trying to figure out the different ways this virus can attack our bodies and the various symptoms it can cause when we seem to be learning new things about it every day.
Growing.
Very good. Thank you, Carl. We're going to try to, we've got a lot of people, a lot of interest. We're going to try to get through a little bit earlier. Someone asked me if I would just take all of the questions from any day and continue to answer them on the YouTube comments section. I would love to do that. Here's the problem. As I've shared with you guys, I'm spending a significant chunk of my day at this point helping large employers get their employees back into the workforce. So I'm having to be a little bit more efficient with my time right now. So let's go back and take a look at some of these questions and answers. Bob Weiss, North Georgia Mountains, oximeter, normally about 95. Is that a problem? 95 is a good number, fairly good number. Are you free of COVID virus? Well, I think so. I hope so. Karen Black, good morning. More tech challenges. Oh, it was such a nightmare. Every time, I mean, it's not every time, but it seems like 2/3 of the time. Either the camera's not working or the computer doesn't recognize the camera. It's, I hate technology. Good morning, Dave. How are you today? I appreciate you joining us. Robert Simpson, hello there. How are you? Bob Weiss, North Georgia Mountains. Tricky Vicky, good morning, Doc. Critical care RN here. Thank you for letting us know your background. I do appreciate it. And if others, when you make comments, will let us know a little bit more about your background, we appreciate it. I thought they were talking about DIC too. Since, again, ICU nurse. Yeah, that's what both of us would think. Since COVID-19 affects the heme on red blood cells, could it also be making them sticky, hypercoagulated? Well, that's clearly a question. And I think it's a very interesting question, interesting theory. Bob Weiss, if you start going below 94, unless you're somebody that routinely has it because of some other problems, COPD and things like that, if you're sick, you're normally well, don't have any significant lung problems or breathing problems, and if you get sick with a respiratory viral illness, especially if you have evidence like a positive test that it's COVID-19, you hit 94, you need to be calling your doc. And again, I'm not an expert in that area. We may want, let me do some research on that and confirm that's the number that other folks are suggesting. Lori B, I'm convinced I was insulin resistant. I lost 41 pounds, eating less carbs, no sugar, no more edema in the right ankle. You know what, Lori B, you are not alone. Over half of my patients come to me now, especially folks because of this channel. and what they've learned, they come to me, and in most practices, and when I first started seeing them, they would have been a mystery, because they come to us with significant plaque, significant evidence of, end evidence of insulin resistance, but no obvious insulin resistance, normal OGTT, normal, let me clarify. Most of my folks don't have a normal OGTT, but much better results than you would expect from the major problems that they have with their arteries. And now I've become, I know what to look for, and it's because people have lost weight. You lose 30 pounds like that, and it saves your life. It saves decades of healthy life. And thank you so much, Laura B., for sharing that. Most of the folks that are doing it, by the way, are doing it in similar ways. First, they're dropping their carbs. Then they're going to, they're closing that eating window, and then they're losing that weight. Bob Weiss, oximeter usually 95. Again, Lori B., I'm convinced that, okay, I think we're having this thing jumped around. Bob Weiss, most pulmonologists are happy with 92%. That was Tricky Vicky from the ICU. Thank you, Tricky, for sharing that. Happy with 92% or greater if you're sick. But if your normal is 99% and you drop to 95, that could indicate a problem too. Your lungs are compromised at 88%. Great comment. Thank you very much for the clarification. Depends on your normal and your baseline. Can't wait for your book. You have so much great information. Thank you very much, Karen. The Black Duke, nuclear tests seem somewhat reliable. Yes, that's what your doc will tell you. And again, get the book. Nuclear tests are by far, they've taken over because their, quote, sensitivity and specificity are improved. And they are dramatically improved over the old non-nuclear EKG stress. But you got to go back and think about the design of the test. It's designed to show whether or not you're getting appropriate oxygen because of appropriate blood flow. In other words, it's a flow study. It is not a study for plaque. And all of that is based on the assumption that you've got to have so much plaque that you're occluding flow before you'll get a heart attack. 2/3 of heart attacks occur in people that don't have that much, they don't have occlusion of flow. So thanks for your comment about nuclear stress tests, because it helps me make that point, maybe more emphatically, that 80 to 90, 95% of stress tests in America today are nuclear stress tests. And they're still having that many false positive, false negative results. The bigger one is the false negative result. So nuclear stress, making sure that it's nuclear is not going to help you out. Lori B., oxidative stress. Uda Waima, what's the purpose of this presentation? You know what, Uda, it might not, I started to say something, well, I don't know how to answer that question. Lori B., the endothelia are damaged because virus attaches to the ACE2 receptors there. Are you meaning the intima, the endothelium, THE? That may be a possibility. You know, this virus is attaching to a lot, I think a lot more cells than just the endothelium. Nancy in Canada. Canadian government just announced today that circulatory problems in the toes and fingers are new symptoms of COVID. I don't think they're new. I think they are just now being recognized. Karen Black, I wonder if the clots were there when the patients arrived at the hospital, or if they formed when the patients were inactive, immobile. No, I think there's something, you get a lot more inactivity that does not result in this. There's something unique going on with this virus that's causing some of this problem. We just don't understand it yet. I'm not sure why the system is doing what it's doing. But as you can tell, I'm having a tech problem in covering the Q&A. Do you think it's too early to open the country? You have to test the waters. I don't think it's too early to start getting people back into the economy, into work again. That's what I'm spending, getting close to half my time doing right now. But people, we talked about this before. I think it's, or have we passed the peak and getting folks back? And we covered both of those things. It's similar to the question about past the peak. What do you mean by opening the country? Do you mean telling everybody to go out and act like we did 6 months ago? I don't think that's a good idea. But are we able to start opening up the economy, the workday? Yes, depending on how you define it and what you're doing. Dave Murphy, $5. Thanks again for all you do. Thank you, Dave, for all you've been doing. You've helped us out many times. And guys, that's called Super Chat. Carl's got that up on his up on the image here. This top on the right, you see where basically you go down to the chat area, and if you'd like to give us a donation for providing this information for free, we'd certainly help, and we'd certainly appreciate it. Now, here's the way the finances work. Yes, I'm a physician. I've done well, but I'm supposed to be on retirement. I was on retirement again. This is my third retirement. I end up getting pulled back into things because of my interest and my background. Janice and I committed to Janice that I'm not going to spend significant amounts of our retirement money on this channel. The purpose for this channel is to help folks recognize the major killer and disabler, because the major killers and disablers of viewers of this channel, as well as everybody 30 years and older, not only in the country for sure, but in most of the world, is becoming chronic diseases: high blood pressure, prediabetes, heart disease, stroke, and most people don't understand the major cause for it. By far the major cause, as in over 80%, is prediabetes, unrecognized prediabetes. I've mentioned it a couple of times already, and it's because docs really are not geared into looking at the lower levels of it, and those lower levels are what's causing the majority of the damage. Thank you again, Dave. I appreciate it, and again, any little bit helps folks in terms of moving this channel forward and getting that information out. Lori B, thank you for your response, Doc. Jerry West, I'm in my 70s. Good to see you, Jerry. PO2 is usually 98. Will increase to 99 with deep breathing. The number will drop to the mid-90s when you sleep. Yes. In fact, you bring up a good point, Jerry. For years, I had heard about, this yoga and meditation and hearing slow your breathing down. And slowing breathing down never really helped me. I thought it was just a little bit of slowing down, until I did a thing called, I worked with a tool called a carboximeter. What is that? Carbox, carbon dioxide. It's I've got a video on it. It was like 3 years ago, and it's buried, and good luck if you try to look for it and find it. I don't think I could even find it, maybe. But here's what happens. When you slow your breathing down, as in like half your other rate, what you find is that your body will calm down. There's no question about that. So it gets under that old analogy or that old saying of, I knew he said this, but I didn't know it meant that. Yes, just slowing your breathing down just a little bit is not something that you're going to notice. But in the meditation area, if you slow it down dramatically, your PO2 will drop a little bit. But what also happens is your PCO2, your carbon dioxide will increase and get back up where it needs to be, as in the 40s. Usually when we get excited, our carbon dioxide drops significantly below 40, and that squeezes off the arteries to the brain. It makes us even more excited and less able to think. So try that. Barbara McIntosh, I have MTHFR. Red blood cells are larger than normal. Is this more of a problem for COVID-19? It's a great question. We don't know. You hear Z-Dog and some of these other folks talk about MTHFR and say, well, it's not a significant issue. Well, you know what? If you're seeing a patient for a week in the ICU, that's correct. It's not a significant issue. But if you're seeing a patient for decades and helping the patient, if your time frame is like mine, decades worth of life, MTHFR makes a big, big difference. We actually have a couple of things that we provide. We're going to be doing a lot of interest in this space. I've made some changes and some improvements in what we provide. We actually have a supplement now that we provide for MTHFR. I have MTHFR. Over half of us have MTHFR. For those of you that do and don't want to get involved in checking out our channel or our activities, you can just get it on Amazon. Something like, it's the B complex vitamins, methylated B complex vitamins, if you have MTHFR problems. Thank you, Barbara, for sharing that topic. At Rob, last scare with clot in 2015, D-dimer was 10 times normal on the blood work. Found no clot after numerous tests. Did the D-dimer do its job? It's a great question, Rob. Doug, I was listening to Doug Thompson's presentation to his Wellness Dental Network last night. That we were talking about D-dimer, and again, it's a great question. Gianluigi. Hi, Doc. Good day from Milan. Good day from you to you. Thank you so much for introducing yourself. I'm also on baby aspirin once a day after an event, myocardial infarction, heart attack, in 2016. What's your opinion on using the lumbokinase supplement instead of a baby aspirin? Lumbokinase, John Luigi, I haven't heard of. I've heard of a lot about streptokinase, nattokinase. If it's related to one of those, yes, the theory's good. Those two kinases, whether lumbokinase or not is part of that group, I'm not sure. We'll have to clarify for me. But nattokinase, serapeptase, they are things that break down proteins. So the theory is that they're going to break down the protein of a clot. The problem is, if you start looking at the clinical trials on it, they're not convincing at all. And I suspect that it may be a problem on getting it past the stomach acid. Now, when I say that, it's like you got to have skin as thick as a wall or elephant or something to do this stuff on YouTube. People say, Doc, you idiot, you don't know that you take enteric-coated streptokinase, nattokinase. And I may be an idiot, but I already know that. It's nattokinase. I haven't seen nattokinase that was not enteric-coated. Maybe there's some available. But here's the thing. It's still... And have you ever really, those of you that are making that comment, have you ever really looked at the effectiveness of enteric coating? It's not so good. So, Joanne Luigi, maybe that was helpful, maybe not. I appreciate your interest. Michelle Curley, I've read it's just as important for COPD to clear CO2, and if CO2 gets too high, is it bad too? Yeah, you'll see people with COPD. Chronic obstructive pulmonary disease, chronic lung disease, and these folks will start getting used to, their brain will start getting used to higher and higher levels of CO2. Now, this whole CO2 issue is something we discussed at length yesterday if you were not available, because we were talking about this problem on pulse ox where your oxygen's dropping significantly, but you don't notice it because you're losing your ability to oxygenate, but you haven't lost your ability to blow off the CO2. And so people that are waiting to go on a ventilator are sitting in the ICU looking at their cell phone. Just weird. That's with COVID-19. Gaby Hernandez, who is a candidate for anticoagulant meds? Clearly, I think this is sort of like the issue with prediabetes. Most people with prediabetes don't know it. Most people with paroxysmal atrial fibrillation don't know it either. And most people that have paroxysmal atrial fibrillation should be on these anticoagulants. Paroxysmal just means that it comes and goes. That we used to think that most strokes were cryptic, couldn't find out the reason for them. And then as we started discovering this linkage to paroxysmal atrial fib, we started finding more and more and more of the strokes that we didn't know the origin for were actually due to atrial fibrillation. And aspirin doesn't work for atrial fib. It's a different type of mechanism. Easy for me to say, sickle cell anemia, question mark. I don't really know if there's an association with sickle cell. It's an interesting point. David Ivers, good morning. Barb McIntosh, are you from Westchester? Old Geezer, 47, love the name. I think this is really all about underlying health problems and not COVID-19. What think you? I think you are right. I did and thank you for bringing it up. I did a video, and I showed the image a couple of times. I showed the US and the map for heart attack, the map for stroke, and then the map for COVID-19. And my point was, you know what? The COVID-19 is something similar to heart attack and stroke, and that it's killing the same people. For the most part, the guys that we talked about today, young people without any of this prediabetes, that's a mystery. But that's not the majority of folks that are dying from COVID-19. The majority of folks that are dying from COVID-19 are folks that are at much higher risk for heart attack, much higher risk for stroke anyway, because of underlying health problems. And here's the kicker on that, Geezer, 47. The vast majority of that's preventable. That's the purpose of this channel. Barbara McIntosh, no, Georgia. Amazon, I measure my oxygen with free Android app. Eye Care Health, it also measures blood pressure and rate. Folks, it's been a great morning. I appreciate the comments. I appreciate the interest. And as I mentioned, I'm trying to be a little bit more efficient, to spend a little bit more time helping folks get back to work. So thank you. Carl?